Hello everyone, welcome back to Cribwolf Talks. My name is Lino Fera. Chronic pain is defined as pain that persists longer than 3 months. 1 in 5 Canadians, or nearly 8 million people, live with chronic pain. When not effectively managed, pain can have significant negative impacts on many aspects of an individual's life and on the lives of those around them. Opioid medications are sometimes prescribed by health professionals to help pain management. While opioids can offer benefits such as pain relief and increased function, the use of opioids are also known to have potentially devastating effects. Reliance on the use of opioids to manage pain has increased over time, has had opioid-related morbidity and deaths. In 2018, 12.7% of Canadians, roughly 3.7 million, aged 15 years and older, reported they used opioid pain relievers in the previous 12 months. Among the people who use opioid pain relievers, 9.7%, roughly 351,000, engaged in problematic use. Canada continues to experience an opioid public health emergency, wherein opioid-related poisonings and deaths continue to rise. On Cribwolf Talks, we present complex topics that warrant discussion, that at times require us to invite subject matter experts to shed light on social issues that impact the quality of life of those within our vulnerable population. One such topic is the issue of pain management and addiction. I am very pleased to have on our show Ms. Peggi Shepherd DeGroote, founder, CEO, and president of Wellbeings Pain Management and Dependency Clinic. Wellbeings Pain Management and Dependency Clinic treats patients with substance use disorder, which includes alcohol use disorder and opioid use disorder. There's much more to know to fully understand how a person gets to a point of an addiction and then towards the road to recovery. Peggi, welcome to Cribwolf Talks.
Thank you, Lino, very much for inviting me today.
It's my honor. The subject of dependency clinics and addiction is a topic that needs to be discussed. So let me start with these two questions. The first one, how did Wellbeings become a reality?
Wellbeings became a reality when I realized there was a problem in our community. There was a report that was written in 2006 called Every Door is the Right Door, and that was with regards to pain and talked a little bit about addiction and a little bit about mental health at the time. And at the time, my 7-year-old daughter kept asking me what I was reading, and I told her, and she said to me, how can every door be the right door? What if you choose a bad door, a wrong door? And I thought, out of the mouths of babes, the wisdom that young children have. And at that time, I was just doing due diligence as to whether or not there was going to be any possibility of creating a medical clinic in Burlington where none existed, because Burlington was one of only 4 identified areas in all of Ontario that had no medical care for pain, addiction, and mental health wellness.
Wow. So the Wellbeings is not a nonprofit. It's a corporate legal entity that you've created. And so how is this organization funded?
It's funded by OHIP. So up until now, all of our treatments have been funded by OHIP. But more recently, we have a new treatment for pain and alcohol use disorder. And that treatment is not funded by OHIP. Some of the lead up to that treatment can be, because if people are suffering in pain or have alcohol use disorder, those are things that we're doing already. But currently, the Ontario government does not fund the treatment.
Okay, perfect. And so I believe, Peggi, that most of the traffic to the Wellbeings Clinic is by referral. So how is the flow of persons or patients managed by your organization?
So on the pain side, it is required that the patient have a referral, either from their general practitioner or from a specialist, or perhaps from the hospital if they showed up in the emergency department. For the addiction side or dependency side, it can even be a self-referral. So if you're just at a point where you would like to be able to say, I'd like to cut down on my drinking, or I'd like to cut back on my opioid use, you can just come in and we will see you. Now, we're an appointment-only clinic. So the best thing would be to call our medical clinic on Plains Road, and we'll get you an appointment, and there will be a set of intake papers that the person has to fill out, whether that's for pain or for addiction or for both. And once those papers are filled out, then an appointment with a physician will be made for you.
I see, but how does a prospective patient become aware of and access Wellbeing Services? So you're saying it's only through the practitioner, general practitioner? Or,
no. We have lots of people that get referrals from other people who come to see us.
Oh, I see, okay.
So oftentimes, like if we were thinking of, for instance, alcohol use disorder, we might even think, even within our own circle of friends or family, of people that we know who would benefit from that treatment. So then oftentimes I will have a parent or a husband or a wife come in and ask the initial questions. And of course, I can't discuss personally, their spouse or their child. I can just simply explain about the program and how it may benefit somebody who wants help. But you have to want help yourself. It's easy enough to say that, your mother or father came in and they want you to get help. If the person doesn't want help themselves, they're not ready for our treatments.
So what would be the average term of a person, or I guess a patient, entering and exiting the Wellbeings program?
There truly is no average.
None. Okay.
No, because let's say you are a pain patient and you were in a car crash or you fell off a ladder at work and you have an acute injury, something that's just happened. We can take care of pain at that level much sooner and quicker and more efficiently than when that pain becomes chronic pain. So let's say you did something and hurt yourself, but you don't see a doctor for 6 months and you're still in pain. That pain is already chronic. It's a little tougher to help get the help you need at that point. And so I just would encourage anyone who does hurt themselves to make sure they go see their GP, or they might go into the ER department, or they might have a specialist already, maybe a rheumatologist, and then they can make a referral to us. On the addiction side or the dependency side, for absolutely every person who might take an opioid, after 4 to 6 weeks, their body will be dependent on that opioid. And so, we can't say, oh, you're addicted to this, but you may be very dependent on it. And so even weaning somebody from that medication is best done under a medical supervision. And for some people, like if you're a diabetic, we never say to diabetics, when are you going to get off your insulin? And in the same way too, for people who use opioids, and most of them are prescribed, I will say, but that doesn't mean they don't have a dependency on them. And they still, we now know, have difficulty sometimes. We used to have a level of 220 milligrams of morphine equivalent a day is what we gave pain patients. And then several years ago, the pain guidelines for Canada sit at McMaster University. And that limit was reduced to 90 milligrams. So from 220 to 90 milligrams, because what we've learned over the past 15 years is that people build a tolerance to the medication. And once they've built their tolerance, they need more to get the same pain relief. And that's why we sometimes had patients that were having 400 milligrams or 600 or 800 milligrams of morphine equivalent a day that were prescribed by family doctors, because family doctors 15 years ago didn't know that this was addictive. They were told by Purdue Pharma it wasn't addictive. And we now know, of course, it can be very addictive. So sometimes what we will do is work with a general practitioner to titrate their patient to a lower level, because there is a ceiling effect where the patient really isn't getting any greater benefit from the higher doses. And they just become lethargic and they really don't want to do things. They sit on the couch and just watch TV, and we need to get people motivated again and get them so that they enjoy their quality of life and they can actually do something.
Right. So understanding as you say, the magnitude of persons living with pain management and addiction issues, what is the capacity of Wellbeings?
Well, the capacity at one clinic, we've now got 3 in Burlington.
Okay.
We've got 3 different locations that we've opened up at because the need is so great. And we're actually looking at a 4th.
Congratulations.
Thank you. And the Wellbeings model of care is multidisciplinary, best practice, evidence-based, and patient-centered care. So what we really want to do is have a health wellness campus where everybody is on the same site. So if you go see your GP and the GP writes a prescription, you can go to your pharmacist right there. Or if they want you to see a physiotherapist, you can go to see the physiotherapist. Or if you need to have an ultrasound or an x-ray done or an MRI done, that's all on the same site location. So we've actually formed a new group so that we can make this happen in Burlington.
Great. How does your clinic treat pain management and both acute and chronic pain?
So first of all, we need a referral
Okay.
from a GP or specialist. And once that referral comes in, then I'm sad to say there is a waiting list because we don't have enough trained specialists in pain. And they've just more recently changed the requirements for becoming a pain specialist. And it's an additional 2 years of training.
Wow.
And I'm not sure how many people are going into that, but we do know that it's really hard to find pain physicians. And so that makes it difficult because for most people, once they find a pain doctor that makes a difference, they don't want to leave.
Yeah. So walk me through this correlation between acute pain that becomes chronic and the mental health challenges associated with this.
So acute pain is pain that you get from injury time up until about 1 to 3 months.
The short term.
It's the short term. And if it isn't dealt with within that very short period of time, and if your body hasn't healed itself, because God made a very good body so that in most cases, we can heal ourselves. So you don't need to go and see someone about it. You know, if you bruise your leg, given time, your bruise will go away. If you break your leg, then you need to see somebody to get it set and have it fixed properly. And the same can be true in pain, especially for people who have been part of a motor vehicle accident or had a traumatic injury, a fall from somewhere. They may need a lot more help in that. Or it might be that they have a disease. So for instance, they might have multiple sclerosis. And as a result of that, they're in a lot of pain.
Very good. So many Canadians understand the word addiction and may have experienced addiction personally or know a family member, as you said earlier, or a friend who has experienced some form of addiction. So understanding the complexity of addiction and the sensitive nature, can you tell us how Wellbeings treats patients with addiction?
Yes. Patients with addiction or dependency can come in and make their own self-referral. They can call and we'll get them an appointment right away, sometimes even the same day.
Wow.
Because we do offer RAM clinics. The RAM clinic is a rapid access addiction medicine clinic where anybody who suffers from addiction or from dependency that they want to reduce can just walk right in to our clinic and we'll give them an appointment during that time slot. If, for instance, though, they don't have an appointment and they walk in, and let's say it's today, it's Monday, and it's 3:30 in the afternoon, and there isn't another appointment today, then we can get an appointment for them tomorrow. In most cases, we can do next day.
Oh, perfect. So your clinic also offers counseling services, correct?
Yes, it does, and psychotherapy.
Right, as stated on your website, education and counseling are fundamental to overcoming pain and addiction. Can you elaborate further on this statement?
Sure. It truly is important because sometimes we have people who will come in and say, you know, I've had this pain for 10 years and I can't seem to get rid of it. And it's absolutely overwhelming and consuming my entire life. And for people that might tell us that, if their expectation is that they're going to be pain-free and out water skiing next week, that may not be reality. So what we need to do is set realistic expectations for people. And some of that is done because we talk about how long the pain has been there and how critical it is. We map things in terms of pain intensities. We use Pain Quilt for that, developed by Dr. Jim Henry, who is our scientific director at Wellbeings. And we're able to follow along with how well people are doing. And we've learned a few things along the way. One of them is we have to set realistic expectations for people. So going from a 10 out of 10 in pain to a 0 out of 10 is probably not realistic. However, there's lots of ways that we can help people to reduce their pain. And that might be something as simple as dietary intake. It might be that if your knees and hips are hurting, but you weigh 100 pounds overweight, that if we work together and work on what your dietary intake is, we can help to reduce your weight, which in turn makes sure that your knees don't hurt as much and your hips don't hurt as much and your feet and ankles don't hurt as much. So some things are really simple, but sometimes what you think is simple isn't just common sense.
Right. Well, it's all good. That's all true. But I'm a firm believer with every successful social organization, it hinges on strong leadership. So what led you to your current leadership role as CEO and Executive Director at Wellbeings?
I saw people that I loved who really needed help with pain. And my master's in education was in decision-making modeling. And I had just had a baby a few years before and thought that this internet thing was really neat because you could do research right in your own home. You didn't have to go to the library. And so I decided to undertake some research to find out how we could help people who were suffering in pain. And then I discovered that pain and addiction and dependency and mental health and wellness were quite common all in the same person. And the previous models of care, and sometimes even, I will say, the existing models of care, are very siloed. And so Dr. A doesn't talk to Dr. B, doesn't talk to Dr. C. And so people go months or years at a time with no improvement in how they're feeling and with no treatments that help to make them better. So I developed a new model of care that was multidisciplinary and evidence-based and best practiced and patient-centered. And I even spoke about it in 2014 on Parliament Hill and on Queen's Park in 2015 to say, we need to change the way we do certain things here. And now I'm happy to say a lot of people are saying the same thing, which is really great. So we now have some of our family health teams or family health organizations or family health groups recognizing that a one-stop shop, I know about all your medical needs, really improves outcomes. And that's what it's about.
Oh, congratulations. I mean, look at you now with 3 locations and a 4th on its way. And even as a CEO, from what I remember from our last conversation, you just got another certification level and wrote some exams. You just
Yes.
brought that about, just continue to increase the level of knowledge. Is that it? Is that
well,
expertise?
I'm learning something every day.
Right.
There's no doubt about that.
That's good.
I'm a teacher.
Right.
I used to teach math and computer science at high school. And so for me, it's a great day if I've learned something new today. But I also, in my model, have, at the risk of using someone else's model, I call it the Tim Hortons model. And that was where the owner of Tim Hortons had to learn how to bake the donuts. And I'm sure, like me, they cleaned the washrooms and just stepped up to the plate whenever something was needed. And I think that's important in terms of the way that you hire people and the culture that you have in your business. And I think that's really important for me. I can absolutely tell you that I could not want for better staff or physicians at Wellbeings. They're like the doctors without borders. And some of the doctors, like Dr. Michael Boucher, who's my medical director, or Dr. Alison Blaine, or Dr. Sunil Upati, they've been with me for a decade or more. And it's because we make a difference in our community.
Well, obviously, Peggy, your leadership role has proven that people want to work with you, and that's a great thing. I have this question that I wrote down. Are you encouraged by the change you've seen over time towards services offered by specialized clinics for pain and addictions?
I am encouraged.
Are you?
I am. I actually see now that there's quite a few clinics that are offering multidisciplinary care, and I think that's an important part of doing better for people. And I know that when we are trying to get people on board, that people are now looking at how the psychological impacts are very important and how we have to work with the entire person on the biopsychosocial, spiritual levels. And I think that's really, really important, and it's really coming to the forefront right now. So I am encouraged about it very much.
But when we spoke last, you mentioned about we still have a three-tier system of care. What did you mean by that?
Well, most people know about a two-tier system,
Right.
I will say. They say like the tier number one is like most of us, what we have, and you go and see your family doctor, or you go see a specialist and you wait in line, and finally when it's your turn, you get to go. And that's what most of us experience. There is another tier that people also recognize, which is the tier that says we know somebody, so we'll make a call. And you either get moved up to the very top of the list or somewhere near the top of the list so that you're seen in a very timely fashion. And I think that should happen for everybody. I don't think that should be something that is reserved for just a select few. But the third tier is the tier of people that I work with mostly. They are the very complex patients for pain, for addictions or dependency, and for mental health wellness. And oftentimes, they can't even find a doctor, a GP, that will take them because they are complex, because the payment system in our current OHIP system, we have 4 different models. We have a pay for fee service, we have FITS, FIGs, and FOs, family health teams, family health organizations, and family health groups. And some patients are a lot more complex. So if 20% of your patients take up 80% of your time and you're not feeling remunerated properly, I understand that. I truly do. But I advocate for those who sometimes find it difficult to advocate for themselves.
Wonderful. Peggy, if I recall one of our previous conversations, you mentioned about this new entity that you're looking at, that it would involve an expanded multidisciplinary team. It sounded really interesting. Could you elaborate a little bit on that?
Sure. I think what we've been able to do is compile a whole group of dedicated, passionate people to be in one location. And at that location, we will have manufacturing of nutraceuticals as well as pharmaceuticals, custom pharmaceuticals. We will have diagnostic imaging being done so that people who leave their doctors and have a referral can go right away and get their x-ray done, or hopefully their MRI done, or at least within a timely fashion. We will also have a pharmacy. We will have the ability to have labs on site. So if you need blood work done or need urinalysis done, all those things will be on site. And something else that's really cool about this new entity is that we'll have the opportunity to do more research, more in-depth research. We've already published before, and with that publication, improved processes, like in the new alcohol use disorder program and pain, we published, and we now know that we can get better results than typical of what's happened in the last 50 years. And we're really excited about this.
That's great. I mean, it sounds wonderful. It's so forward thinking. I love it. I love what I'm hearing. Unfortunately, coming to the end of our show, and it's a great pleasure having you on the program, by the way. I really enjoyed it, but I can't let you leave without asking this question. What would be the one overarching message you would like to leave our viewers?
I'd like people to remember that at some point in our lives, 80% of us will have had a debilitating, overwhelming pain. And I think that may humble us sometimes to understand how other people are coping with their pain lives, or maybe have an understanding as to why they took the opioids initially, or certainly, addiction follows along with that. And not to be judgmental. We really want people not to pass on the guilt or the shame, and to treat people with dignity and respect. So I think that's really important. And I think it's also important that people find something that they are really passionate about and go out into their community and volunteer and do something to make Burlington and beyond a better place to be, because every community will benefit from your volunteer work.
Wonderful message. Thank you.
Thank you, Lino.
I wish you continued success with your organization and with your team. And thank you very much for being on our show.
Thank you very much for having me today.
I certainly appreciated interviewing Peggi Shepherd DeGroote, founder, CEO, and president of Wellbeings, a social enterprise addressing a very important social need, the treatment of pain and addiction. We have heard from our guests that there is much to learn about pain management, from acute pain that progresses to chronic pain that introduces opioids to manage that pain, which then becomes addictive, and the cycle begins to spiral out of control. Is there a solution to this phenomenon? As we have just heard from our subject matter expert, that a solution may lie with the effective use of clinical intervention and counseling. There are many social enterprises providing a host of valuable services in our communities, and it is always good to spread your message. So if your social business is affecting change and you wish to showcase your work on our program, write to us at info@cribwolftalks.com. Lastly, keep watching our monthly episodes on Your TV Halton, Cogeco's Community Channel 100, and on Rogers Channel 14, Hamilton, Ontario. And if you have missed any of our webcasts, visit YouTube and type in Cribwolf Talks. All of our past programs are there for your viewing. Thank you for watching. I'm Lino Fera, and have a great day.